morning, Sunrisers. I'm Dr. Karen Emerson, and today I have with me my technician Annabeth, and this beagle right here is Circe. Circe is actually 14 years old. She is making a little noise because she's very, very nervous, and when she gets nervous, she has a little bit of what we call collapsing trachea, and she will make this noise. But Circe presented, guys, with these 3 very large tumors on the right side of her thorax right here, and I'm actually going to show you the x-rays and actually show you the way we took them off. Circe was basically to the point, her owners were the point where nobody else would do surgery on her because of her age. And of course, you know, here we do a lot of what we call geriatric medicine, meaning I do a lot of surgery on animals that are 14, 15, 16, 17, even 18 years of age. Our anesthetic protocol is very, very, very safe. So what we did is we did blood work on Circe, and we also did something called a metastasis check. And what that means is I did x-rays in her chest and everywhere to make sure I didn't see any other evidence of any internal tumors growing, so that we know the surgery would be a success and we weren't just prolonging everything. So we did go in, and actually we made a very large incision and removed these 3 tumors, and it was so important that the owners brought her in what they did, because the type of tumors that we removed were basically called soft tissue sarcomas. That's a type of cancer. They were about to rupture, and when they rupture, they get a systemic inflammatory response, and they normally die. So we were really minutes needing to get her in here and get this surgery performed. So this is actually the tumors that were on Circe. As you can see now, they've been removed. And then this is actually me holding the tumors. I actually was able to remove them all in one large unit, and we were actually able to get all of the cancer. And she did perfect during anesthesia. And this one right here, I mean, they were getting ready to rupture. So, I mean, I'm so glad we didn't wait, and I'm so glad the owners put their trust in me to put their 14-year-old dog under anesthesia and have this done, because they're getting a lot of extra time with her that they would not have had. So it is so important if you have an older dog. If even a lot of people even think the age of 11 or 12 is old. It's not. We can do surgery as long as up to 15, 16, 17 years of age, as long as the blood work looks good. We use such a safe protocol. So if you have an older dog that has any tumors or experiencing anything, don't hesitate to give us that call and make that appointment. You can have a good, long quality of life with your dog even if they're older. And I promise your pets will thank you.
WCBI Animal Health with Dr. Emerson was brought to you by Emerson Animal Hospital in West Point.